Hello, everybody. I think we're broadcasting live, and I'm thrilled to be back with all of you, and especially with my wonderful, brilliant, awesome colleague, Dr. Jill Levitt. And we're going to be taking your questions today. This is October 7th, 2018, a beautiful day here in California. We had our Sunday hike this morning that went just great. And we had a small group. Last week we had, I think, 15 hikers. And then this morning we had just 3 hikers. So it's so unpredictable, but we just had a great time and did personal work and difficult case consultation. We're just eager to get going with all of you. And I'm thrilled to announce that we have tons of viewers right now, live viewers with us. That 0 actually.
I wonder, are you certain you started the broadcast?
Well, I believe so. I think we're broadcasting live.
Okay. All right.
But maybe
let's keep talking to ourselves then.
Lisa Kelly would help us. That's the show. Let's see, live comments show. It says end broadcast up at the top.
That means we're in it.
We must be doing live. Let me do show here. No, that just shows something or other. Goodness gracious. Well, do you think we should push ahead? Or?
Yeah, carry on and hope that people join us. And if not, we'll have a recording of our schmoozing and we'll see what happens. Yeah. Maybe we'll be better without an audience, David.
Yeah. Q&A, we'll make up the questions and answer them. Dr. Burns, I have a question. Why are you and Jill so awesome? Is it just because of genetic, or is it more
no one like you?
But I'm looking at my controls here that says show, comment, agenda, show, and broadcast. So yeah,
right.
But you think
if you're
Lisa
getting
Kelly,
an option of ending,
my email.
Okay.
Why don't you read the question? Can you read the question from Karen?
No, I can't. But I can explain it.
Yeah, there's nothing from Lisa Kelly. And
I have a 15 on my screen under viewers, so I just think no one's reacted or commented, but I see 15.
Oh, we got 15 viewers? Yeah. Oh, yes. Okay, hello, 15 viewers, but make a comment or make yourselves known because we can't see who you are.
Okay.
Okay.
So David, why don't you read the question? So we'll tell everyone that we got what we thought was just an awesome question from a viewer. Question a lot of us can relate to about some struggles with a teenage son, and sort of the question was whether or not we thought that we could use the 5 secrets of effective communication, which we've talked about as a great empathy toolbox with a difficult teenager. And David and I thought, yes, absolutely. So David's going to go ahead and read the specific question, and then we have even more details about the situation to share.
Yep. Hi, Dr. Burns. I greatly appreciate you and your work and regularly listen to your podcast and read your books. I just had a quick question. Do you think that the techniques you have developed, like the 5 secrets of effective communication, can be helpful when trying to repair a relationship with an angry teen over which you have to have some measure of control as a parent? I imagine I know the answer, but I'm curious as to your thoughts. Again, thank you so much for your work, Karen, and thank you, Karen, for that awesome and excellent question. And I wrote back to Karen and said that you definitely can use these techniques with teenagers and with children as well, but it's always great to have a specific example. That way we can give you really a terrific answer. And so I sent Karen a relationship journal similar to the ones you can find in my book, Feeling Good Together. And the whole idea behind a relationship journal is to focus in on just one interaction. What did the other person say, and what did you say next? And when you analyze that one interaction, you'll see why the relationship isn't going well. All understanding will be embedded in any one brief interaction between you and someone who you're having trouble getting along with. And then when you see how to repair the relationship at that one brief moment, you'll understand how to solve virtually any problem in that relationship, and conceivably any problem in any relationship. So we'll read her relationship journal. I'm still feeling a little uneasy though, because now we're up to 20 viewers, and generally we can see all their comments and stuff.
Right. Yeah, so maybe we can just ask our viewers, can someone just type something in the chat box, like, hi, Jill and David, or something, so that we can check that that's working. I agree. We can tell it looks like we have 20 viewers, but there's 0 reactions and 0 comments, right, David?
Yes, that's right.
Yeah.
That's right. And there could be something wrong with the software.
With the chat box, yeah. I'm going to type something in too. I'll just write like, hi, everyone, and just type.
I'm going to check my email too from Lisa Kelly and see if she can give us some hint as to what's going on.
Okay.
Yeah. I know that I don't see anything from Lisa, any new emails. Oh, here's some from Lisa. Let's see, you're on. Okay, thank you, Lisa. You're on and getting responses. Interesting. And we can't see what those responses are. I know that Facebook had a meltdown of some type this week. I don't know if it has to do with that. There's a 1 down here. Oh yeah, I see your note.
So you saw my note. Yeah. So basically, just so everyone knows why we're dawdling here, but we should probably just forge ahead, David, because I feel like if people are here, they'd want us to not be staring at our screen, right? But actually connecting. So the issue being that we can't see anyone's comments, which is definitely a bummer. But I think, the only other thing, David, is if you wanted to stop the broadcast and start it again, but then I think everyone would have to log on again.
Oh, I see.
I don't know. It's just an idea.
I'm going to hit reload. We'll see.
Problems.
I reloaded it. That's probably not the same as stopping it and starting it again.
Yeah, so basically we can broadcast and people can see us. We just can't see their comments or reactions.
But it's so, I could do a help thing to be live. I'm going to send them a quick email. Reply, I'll just put help. We cannot see the comments from our viewers. They can hear us. Can you help, David? And then I just got a call, so I'll answer that. Maybe that's Lisa or somebody.
This is our show on what not to do when you're live. I'm also going to check on Facebook and see if I can.
Okay. Yes. I thought that too. Okay, we'll do it that way. Yeah. Okay. Okay, we'll do it that way. Thanks. Great. Lisa said just go ahead and she'll forward some of the comments.
Okay, I was going to, what I'm doing, David, is I'm trying to log in to your public page, and I might be able to see through my
they're here now, all of a sudden.
Okay.
Did you just do something to make them appear?
No, I didn't.
Well, hello, John Jerry. Hello, Mona Lisa. Hello, Klaus Strem.
Okay, so you can see everything.
David Mitchell, hi. Dan Prine, hi, Dan. You got to come up for a hike again. We had only 3 today, and we would love to have you. Are you in better health now, Dan? Jay-Z, hi. Lisa Kelly, hi. Donald Trump, hi, Donald. It's good to have you on the show again, and I hope my recent sessions have been helpful to you. Sean Stiller, I'm sorry. I'm just so joyous to be that we have our people.
That we actually have, right. Now you get to see us go from sad to manic.
Yeah, Phil McCormick, hi Phil, and John, and Roger Parnham, and Dipty. Hi Dipty, hope things are great over in India.
There's also some notes that says Jill is a ghost. Can you all see me now? Am I no longer ghost-like? It wasn't like a Halloween prank or anything, but
yeah. David Mitchell, is there also one about how to handle obnoxious parents? We can do that today too, if you
obnoxious people, right?
Halloween episode. Jill is a ghost. Yeah.
Okay. Should we get going though, David?
Yeah. Oh, and Rob DiGregorio is here. Hi, Rob.
Okay. And it looks like I'm no longer a ghost, so I think we're good.
Okay. So step one, in step one of the relationship journal, you write down exactly what the other person said to you that didn't go very well. And I'll read steps 1 and 2 and the emotions, and then Jill, you can take over.
Sure. David, I want to say one other quick thing, which is just so that people who are listening, right? So our goal is to help this particular person who shared with us that she was having some conflict with her teenager. And we want to basically show you not just how to use the 5 secrets, but how to use a tool that's called the relationship journal, how to really take a look at kind of one moment in time. But one thing we haven't mentioned that I don't think we'll spend much time on today, but is this concept of agenda setting, right? So the first question that we would really need to ask you is this person that you're in conflict with. You all can think about this for a moment, but imagine that you're wanting some help with someone that you're in conflict with. The first question we want to ask you is, do you really want to get close to this person that you're in conflict with? Like you just told us kind of what a jerk so-and-so is, or how difficult your teenager is, or this or that. If we could kind of wave a magic wand and you would instantly be really like close and connected with this person, would you wave that wand? Would you want that? Right? Yes. I gather with usually with parents and children, there's a kind of a no-brainer. Like, of course, I want to have a good relationship with my son. But the other question that we often ask people, which does feel really important in this instance, is like, are you, who's more to blame for this conflict? And in this case, I can imagine that she comes to the table thinking, my son is such a pain in the neck. I need to fix him. And really, the tools that we have to offer are all about taking a look at your own role in the relationship. What are you doing that might actually be pushing him away? And are you willing to take responsibility for your role? Are you really willing to take a hard look and think about how you could do a better job?
Absolutely. Yeah, well stated.
So we do all that sort of agenda setting with you first. And then we jump into the relationship journal, which is where we're going to go now.
And also, when you do the relationship journal, it can be helpful to conceptualize the nature of the problem you're having with this other person. Like in this case, it's a teenager who doesn't listen, doesn't obey, doesn't show you respect, and doesn't want to hang out with you. Would that be a fair way of putting it?
Yep.
And then when you analyze the interaction, it's somewhat shocking, but you discover that you're actually causing the other person to treat you in that way. And that's painful to see. It involves the death of your ego, but it's also empowering because once you see what you're doing that's causing these bad reactions from the other person, then you're empowered to respond in a radically different way.
Yep.
And get a far more loving and warm and trusting reaction from the other person. So anyway, my teenage son says, what the background, the son lives with me almost full time and with his dad and dad's new wife every other weekend. But my son broke a small rule about taking friends in cars. And so she was, I guess, trying to enforce a rule or punishment and punish him. And the son said, I don't care about the punishment because I'm going to move in with my dad on Monday. And so the son is being rebellious, defiant, disrespectful, and pushing mom away, wanting to avoid mom. And then Karen said, then you're moving right now. I'm not going to deal with your attitude for the next 5 days. And so we also asked Karen to circle the emotions she thought her son was having and also circle the emotions that she was having, because she thought her son was feeling unhappy and stuck and mad and upset. She circled those feelings out of a list of about 20 feelings. And then she was feeling panicky, frightened, incompetent, unloved, unwanted, rejected, abandoned, despairing, stuck, mad, and furious. And now Jill will reveal the magical solution.
Well, so we do have people then write down, again, as you can see, this is like a moment in time, right? So what did he say? I don't care about the punishment because I'm going to move in with dad on Monday. And then what does she say in response to that, right? That's the thing we're focusing on, which is then you're moving right now. I'm not going to deal with your attitude for the next 5 days. So David and I, we see it, our role as essentially to look at how is she responding to her son? And we're also trying to think about how what she's saying to him in that moment is actually the problem. Like how she responds to him in these moments is actually what perpetuates this dynamic that she doesn't want to have with him. Right. And so we ask her to like look at what she said in that moment and to ask herself these questions. We ask, was your response an example of good or bad communication? Was it empathic? Was she acknowledging? You all can actually answer this in the chat box. Like when she says to him, then you're moving right now. I'm not going to deal with your attitude for the next 5 days. Was she acknowledging his feelings and finding some truth in what he was saying to her? And you can indicate that.
In fact, what we're going to do here, we're going to do EAR, empathy, assertiveness, and respect, and ask, was she being empathic? Was she being assertive? Was she conveying respect? EAR, empathy, assertiveness, and respect are the 3 keys to good versus bad communication.
Right. And so we first ask you, and David, you can look at the chat while I'm reading it, but so was she acknowledging his feelings? That would mean that she was saying, oh gosh, Josh, it sounds like you're feeling A, B, and C. Is she acknowledging his feelings? That would be being empathic in the moment, right?
Yeah, and Roger, Sean, and Lisa all vote no.
No, right. She would get a check marks in the ignoring his feelings and insisting that he's wrong. And then the next piece is assertiveness. And by assertiveness, we mean something very specific here. Our definition of assertiveness is expressing your own feelings. So was she expressing her feelings using feeling words, right? Sharing her feelings with him openly and directly.
In other words, she had, by her own admissions, 2, 4, 6, 8, 9, 11 feelings. Did she mention any of them? Did she say, I'm feeling X, Y, and Z right now? Notice what she said to him. Then you're moving out right now. I'm not going to deal with your attitude for the next 5 days. And by the way, sharing the fact that you feel angry or hurt or upset is not the same as acting it out or attacking the other person. So, yes. So Christine says that she was attempting to one-up him to regain power. That's beautiful.
Absolutely.
Right. And Lisa gave us a helpful note, EAR. Adam says no. Sean, assertive equals no. Absolutely.
Right. So she's failing to express her feelings or what some people say is, oh, I was expressing my feelings, but they're actually being aggressive, right? They're attacking the person. They're not saying, hey, Josh, I'm feeling A, B, and C, right? Hurt or upset or angry.
Yes.
And then,
and just before you go on to respect, Christine so thoughtfully pointed out that she's attempting to one-up him to regain power. And what she's doing, he's inviting her to do battle.
Right.
And she's accepting the invitation. And by accepting the invitation, she actually gives him the upper hand.
I also think, David, and maybe this is even a broader topic or a bigger topic, but I think her goal in the moment, at least the way that it sounds when you read this, is to control him.
Yes, right.
Rather than to connect with him, right? I mean, her goal in the moment when she says what she says is clearly not her best attempt to be caring or empathic or connecting, right? It's just trying to kind of squash his independence, I think.
Yes.
Right, which is clearly going to have the opposite effect. I mean, if someone's going to tell me what to do and put me in my place and punish me, I'm going to want to flee, right?
Yes. And by the way, and this, I don't want to change the subject here, but someone drove me home from the airport from my LA workshop, a beautiful lady, but she was also involved in a different kind of power struggle with her son. but it wasn't adversarial like this. But still, when we role played, she's trying to control him, help him, tell him what to do rather than to get close to him, to listen to him, to communicate with him. And it was very, very pronounced. And I think it's odd to me, but I'm sure I was a lousy parent in many ways too. But it's just shocking to me how hard it is for humans to communicate, or even to want to communicate, even with the people we claim we love. And you can
see, or to value connection really over power or control. You know?
Yeah.
Absolutely.
Yeah, it's mind-blowing. Well, what's this R have to do with?
Right. So R would be respect. That's what it stands for, respect. And it means it was, the question we ask you guys is, was her attitude in this communication to him respectful and caring when she said, then you're moving right now. I'm not going to deal with your attitude for the next 5 days. Does that sound respectful and caring? You can enter a yes or a no or other thoughts in the chat box.
Lisa made a nice comment. I recognize listening to this how I could improve my relationship with my kids. Yeah, we could all improve our relationship with everybody. That's why I got such high ratings in LA. I told myself I'm going to treat every person with respect. I had another nightmare before I went down there, thinking I was going to...
David just had a conference in LA. That's what he's talking about.
Yeah, and I got the highest ratings I've had in 30 years of doing workshops on day one, 4.95, even a 4.85 would have blown my mind. That's out of awesome. 5 points. That's and awesome. It was because of this whole thing of respect, but I had to be shocked by a nightmare. I saw myself as kind of hurting people, and then no one came to my workshop, but a few people just said, well, we're not going to your workshops because you seem real arrogant. And stuff like that. And I suddenly said to myself, David, convey warmth and caring.
Yeah. Well, I hope I'm not giving away your secret, but you've shared with me, and I just think this makes you so lovable that you'll write sometimes on like a sticky note and put at the top of your notes for the workshop, be nice.
Yeah,
the reason I love that so much is it just shows like, you've got your mind on teaching and this and that, and you're excited about your methods. You need to be reminded, like, be respectful, be caring, be nice.
Yeah.
Right?
Yeah, absolutely.
Yeah.
Okay. But anyway, Ron, it was neither respectful nor caring. And Sandy from Ohio says the same, and Roger says the same, and Sean and Lisa, Christine, no, she shut him down, and Dipti kindly said, wow, such a lovely line, valuing connection more than control. Connection. And boy, that could be a political thing too, but I promised Lisa not to get into politics.
We won't go there,
but you see the same issues that on all sides. Let's do battle rather than let's get close. I'd rather fight you than love you. I'd rather destroy you than listen, get close. We don't want to get overly dramatic here, because I think Karen's a good egg who really, really loves her son.
Right. Well, that's the point, though, that even someone who obviously is writing to us asking for help and cares a great deal, can just, in the heat of the moment, you can feel really overwhelmed and upset and hurt and just respond, kind of with anger.
Yeah, and I don't see a Karen on our viewing list. I emailed her invited her to the show. Of course, she can watch it on the recording.
Right.
So
should we read the next one, step 4, David?
Yep. Well, step 4, yes, you can do that. Yeah, explain what step 4 is and read her response, and then we'll add to it a little.
Yeah, right. So the question we ask our patients then, and again, you can do it yourself if you're using the tool on yourself, is after we say, was it good or bad communication? And by the way, Karen very openly checked off bad communication on all of these, not empathic, not assertive, not respect. So she saw that herself. And then we say, and did what you said to your son in that moment, did it make the problem better or worse? And so she wrote, worse. Everything escalated and he moved to his other parents. And despite 2 visits with me over the past week,
2 short visits.
Oh, sorry, 2 short visits with me over the last week. So not good visits. We continue to be at odds. He has said he doesn't want to see me, and he says he's not coming home. And the other parent is not supportive. And that is so hard. That makes me so sad. It's heartbreaking, right? She's really wanting our help and saying, hey, this fight I had with my son is ultimately leading to him now kind of moving out and living with his dad or his other parent and being at odds with me and not wanting to see me.
Right. Now let's enlarge a bit on step 4 before we go on to step 5. He says, I don't care about the punishment. I'm going to move in with my dad on Monday. So he's showing rebellion and disrespect, right? And why does her response force him to be rebellious and disrespectful? See, this is the real death of the ego, and we don't do this to be cruel. But in step 4, she said, here's the general consequences were bad, but we want her and all of you and ourselves as well to see the
why, right? The question is why.
Yes. Why did things escalate? Exactly. Why did he move to his other parents' house? In other words, what was the impact of her response on him? But why did her response impact him like that? The idea here is to see how we create our own interpersonal reality. It's a Buddhist concept, but it's in most religions that we create our own interpersonal reality at every day. We feel like victims, but we're actually causing all of this. How is Karen causing her son to want to move in with his dad and put her down and ignore her attempts to discipline or her attempts to be a good mother? Yes, as Sean says, because to acquiesce to her demands would pin him down to be controlled again in the future. That's a good one. What are some other ideas when she says, then you're moving out right now? See, he says, I don't care about the punishment because I'm going to move in with my dad on Monday. And she says, then you're moving out right now. I'm not going to deal with your attitude for the next 5 days. Let's see. The relationship journal. Thank you, Lisa. Yeah, you can get a copy of this form in the book Feeling Good Together. And if you want to learn this stuff, that's a good place to start. And then Jill and I are going to have a full day workshop on this in a month. We'll mention at the end of the workshop if you want to attend.
And let me just ask people, what we want you to think about is this, like, so if you're he's saying to her, I don't care about the punishment, I'm going to move in with the other parent on Monday. Not only is he then controlled by her response, which I think Sean points out, but I mean, do you feel at all cared about? Do you feel respected? Do you feel listened to? Do you feel understood when she says, then you're moving out right now? I'm not going to deal with your attitude. Kind of like I'm not going to deal with you. She's not really communicating that she wants much to do with him either.
Yeah. And Adam says she's pushing him away further, which only increases rebellion.
Absolutely.
Right. And also, how do you folks feel when someone doesn't listen to you? See, she's not listening to him. Hode says, let's see, there was one that Hode said one that disappeared.
Yeah, that means I don't care either. Exactly. What Hoda said, when she says you're moving out, I don't want to deal with your attitude, is essentially saying I don't care either, right?
Yes.
Yeah, I think that's right. Yes. And I want to say, to be fair to Karen, like, there's no way that's how she's feeling. I mean, she doesn't not care. Of course, she cares deeply. She just probably feels really sort of flooded and trapped, and she doesn't want to back down, and she doesn't know what to say in the moment, right? It's
like she's telling him, go to hell.
Right. Pretty much. Yeah.
Yeah. Then you're leaving this house. I don't want you in this house. It just, I'm not going to deal with your attitude. See, like, you have attitude. What you say doesn't count. I don't care about you, and I don't want to hear what you have to say.
Right. And if you're not going to obey me, then I'd like you to leave.
Yeah.
Right.
Yeah.
Right.
Wow. It's painful to have to look at this.
Christine said he wanted to see whether she will partner with him to find new ways of relating. And she's not taking that. And Dipti said maybe he will end up feeling uncared about, which
because as a teenager, you're growing and changing and moving from this dependent relationship as a child to an I-thou relationship of two loving adults.
Yes.
And so as part of that, he's wanting to be heard and understood, that he counts, that his thoughts count.
Yep. And David, I think that a lot of parents probably, it is a really hard transition. I should say David knows this, but I've got a teenage son myself, and it is a really hard transition to go from where you really do have to make all the rules to kind of keep your kids safe, right? To a place where you're maybe actually wanting to hear from them and allowing them to communicate their I don't know, their wishes. You have to create more flexibility in your relationship, and I think that's hard for parents.
Yes, when you try to control, someone says when you try to fix, to help people and save people, you're seeing them as broken. And then when you're trying to control people, how are you seeing them?
Say that. I'm sorry. I was reading one of the responses. Say that again. Okay. No, go ahead, David.
Well, I was just saying, see, the one on the way home from the airport, the woman is trying to, help her son and give him all kinds of advice that really is real obvious stuff. Why don't you do this and why don't you do that? Things anyone would think of. But when you try to help or rescue someone, people, you're seeing the world is broken. If you're always trying to help and save and rescue people.
Yes.
And that conveys that you're an expert and they're kind of an invalid.
Yes, and that they're kind of incompetent in some way.
Right. And now here she's trying to control him.
Yes.
And when you're trying to control the world, what message do you convey?
Yeah, that the other person is smaller than, less than, again, also kind of incompetent or
and dangerous, weak. Irresponsible, lacking in judgment.
Yeah.
Right.
Absolutely.
And not capable of making good choices. Right. If you try to control them, you see them as incompetent. And then Edgar is saying nobody has a perfect family. Everyone has problems to face. What do you mean, Edgar?
Right, of course.
Yeah, we all have sad problems in our relationships and families. Okay, well let's push ahead. But we just wanted to say that see, Karen is forcing him to fight her, to not want to be with her, to be disrespectful to her. And that's different from the way most parents think. It's like, what's wrong with my child and how can I fix my child? Rather than when you look inside, you see you're actually causing them to behave in this negative way.
Yep. Right. And if we can model too, like if he's being disrespectful to her and she's being disrespectful to him, it's just going to lead to an escalation or a standoff, right? Or a kind of Cold War. And if instead we can teach her to actually respond to him with empathy and with caring and with respect, she's also essentially modeling this as a way of being in the world, right? I mean, the likelihood is if she's doing that with him, at some point he's going to pick up on that and do that in return too.
And what we're talking about is really kind of a spiritual ideal like Gandhi. Isn't that the way he was?
Yeah.
He kind of changed the whole continent by treating people with respect instead of putting people down and accepting the invitation for war.
Yeah. Well, David, my guess, you and I talked about this, so I just want to bring it up. My guess is that if she were here with us, that she would say, and maybe this is what Erica said, Erica, who is awesome with us at FGI, she just posted a comment, and maybe the woman Karen might say, but David, but Jill, if I treat him with warmth and empathy, aren't I being like a doormat? Like, am I then saying it's okay to disobey? And I think it's important for us to say that we think it's perfectly reasonable to have consequences for behaviors. We're not saying that you'd need to go back on your consequences. We're just saying that, like, if you put down a consequence and then your kid says, well, then this, and this, that you respond to that, to their resistance, to their anger with empathy, not with more consequences or threats.
Yeah.
Right.
Yeah.
So
right.
It doesn't, being kind and empathic is not equivalent to being a doormat.
Yeah, and you're referring to Eric's Hulse's comment here, right? Yeah, you're either controlling or a doormat.
Right.
But and that's one of the problems that people have in learning and growing, because they see, well, if it isn't this way, then I'm going to go this other way.
Yeah.
But they go from one dysfunctional system to another dysfunctional system.
Right,
and we're talking about something up higher than either of these opposite dysfunctional ways of being. But one of the reasons people have trouble learning the 5 secrets of effective communication is they keep thinking in kind of these all or nothing extremist ways. Well, let's get on with step 5. People may be impatient with us.
Sure.
So I'll read what she said in her revised version, where you use the 5 secrets of effective communication, which are in no particular order, but they're the disarming technique. That means finding truth in what the other person is saying. Thought and feeling empathy, that's repeating the other person's words and feelings so they know you heard and can tune in to how they're feeling inside. Inquiry is asking gentle, probing questions to get more information about how the other person is thinking and feeling, and to find out if you're reading them correctly. I feel statements is sharing your feelings with the formula like I feel X, Y, and Z, or X, Y, and Z are feeling words. Like I'm feeling sad, I'm feeling hurt, I'm feeling a bit annoyed, I'm feeling lonely right now, I'm feeling frustrated, and I feeling kind of incompetent, whatever the feelings are. And then stroking means to express love, respect, and warmth, even in the heat of battle. And being loving and caring and respectful does not mean that you're not allowed to be angry. You're allowed to be angry and to share your anger. But the question is, are you going to share your feelings in a loving, respectful way, or kind of in a hostile power struggle way? So,
and should we share what Karen wrote for her revised version, David?
Yep.
Yeah. Should I read that?
Yeah.
Okay. So Karen, we gave her the relationship journal and had her do this work. And so on her own, she came up with a new way of responding to him. So again, he says, I don't care about the punishment because I'm not going to move in with because I'm going to move in with my other parent on Monday. And she revised her communication to say, I think that maybe you're feeling embarrassed that we have different rules from your friends. That makes sense, and it's hard. I feel sad that you want to move to your dad's house. I really love having you here with me, and maybe we could just take a break and come back and talk some more.
Okay, great. And this is certainly way better than her initial. And our job, I guess, is to kind of fine tune it and to say what's working and what's not working, and see if we could make it even stronger. Should we start out and say what we like about it?
Yeah, that's a good idea.
Well, when she says, I think that maybe you're feeling embarrassed and that we have different rules from your friends, I think that sounds pretty good.
Yeah.
He may be feeling like they're allowed to hang out in each other's cars and go driving all over the place, and that her rules for him are for a younger kid, whether he's right or wrong. He probably is feeling like that. So I would give her some
kind of like you're stricter with me, you're harder on me than my parents' friends are. You have harder rules than my friends do.
Yeah, I give her an A on that.
Yeah, I agree. I'll give her I'll give her an A, and I like how she says that makes sense, and that's hard. I would have liked, I think actually, and she has a beautiful empathy with you're feeling embarrassed. I just think that it's also missing.
Wait. Oh. What are some other feelings that he has that she didn't acknowledge? Yeah. Can you folks suggest that? Like, what feelings does he have that she needs to acknowledge?
Right.
It's the feeling that no therapist in the United States has ever acknowledged. When we're teaching therapists, they just can't seem to acknowledge this feeling either. Yes, Dipti, way to go, Dipti.
Right.
Anger. Anger, and Roger too, and also frustration. And that's one reason that we have on the step 1 of the relationships journal circle the other person's feelings, you see, and she knew very well he was mad, upset, stuck, and unhappy.
So we got lots of people writing down anger, which is great that everyone can see that anger, frustration. Yeah. I also would probably like to say hurt, I mean, anger is super important, but I'm thinking that he probably also feels kind of hurt, or you could even say controlled. I'm guessing that you probably feel awfully controlled by me.
Yeah, that would be great. And you makes you really unhappy, and you feel kind of stuck, and you probably feel, upset, understandably, and really, really mad at me. And then I would add, and with good reason. Right. You're wanting to be more independent. You're getting great self-confidence, and I'm kind of probably, you feel like I'm trying to control you like a little boy or something.
Right. That would be wonderful. Yeah. That'd be great.
By the way, Jay-Z asked, is resentment a feeling? I would say absolutely, it's a feeling. Yeah, and you can definitely acknowledge that. Right. And then, Edrani said maybe he's feeling rejected or unloved or unappreciated. Totally. Absolutely. And rejected and put down.
And our point is essentially, we love what she did here with that maybe you're feeling embarrassed and saying that makes sense and it's hard, because that's really disarming. That's saying it makes sense. Like there's total truth to that. We're just saying we'd go even further with acknowledging some of these other tough emotions like anger, frustration, hurt, resentment.
And then in her revised version, she does something beautiful. I feel sad that you want to move to your dad's house. I really love having you here with me. That part I like.
Right. So that's an I feel statement, right? I feel sad. And then I really love having you here with me is what we'd call stroking. It's kind of an expression of warmth.
Yeah.
Right.
And then she has some other feelings that she could have acknowledged. She circled 11 feelings or 9 feelings. Like she could have said, I want you to know that, I'm your mom. I'm supposed to be the expert, and I'm feeling a little incompetent right now. And sometimes I feel frightened and a little rejected and abandoned. And, I have a feeling maybe I'm making you feel kind of rejected and unappreciated as well. And as much as I love you, I get the feeling really, really mad and kind of furious sometimes too. How's that?
Beautiful.
Yeah. But I love you so much. And then at the end, she says, maybe we could take a break and come back and talk some more. What's wrong with that one, Jill?
Yeah, I mean, it's not, I think what's lacking is inquiry. I would love an invitation for him to share his feelings with her right now, right? She sort of softens things and expresses her feelings. I love having you. But then when she says, maybe we could just take a break and come back and talk some more, to me, that sounds still kind of like I'm dictating, here's what's going to happen now versus like, and how does this sound to you? How are you feeling?
Yeah.
Actually, I want to know more about how you're thinking.
Sometime, but not now.
Right.
Please don't. Please, I hope we don't have to talk. Next year.
I mean, and to be fair, like one way of thinking about it is if she were to feel like this was all I could get out, and I feel flooded, and I can't I can't stick around for more. Like I'm not doing my best. And I want to be in a better place to hear you. Like, I mean, she could share that, right? But that would sound different. Like, I want so much to be able to talk and listen and really work this out. But I'm also feeling, kind of flooded or frustrated or overwhelmed. Like, would you be willing to talk to me about this later? That would be a different way of saying it, right?
Yeah. Right. And that would work, but even better would be for her to finish with inquiry,
Yes,
like you originally
100%.
suggested. Say, can you tell me more what it's been like for you?
Yep.
Tell me things I've been doing that where I'm screwing up and turning you off. I love you so much, and you're growing. You're becoming more independent. I love you for that. I admire that in you, and we need to talk so we can work out how to move forward together as you grow into a handsome and independent and fantastic young man. But I need your help. We need to do this together as a team.
Yeah.
And I just love you so much, and I'm just so sad right now. Tell me what's going on with you. I would love to hear.
Yep.
How's that?
Absolutely. Beautiful, right? So it's inquiry. I mean, it was also some beautiful stroking and some I feel statements, but also ultimately inquiry. Help me understand more about what this has been like for you.
Yeah.
Right?
Yeah. Yeah. And it's a fantastic thing. And we sometimes screw up on it, but it can be done. And I could talk about my failures with our kids, but I'll tell you one small success. Our daughter was just so rebellious, and then she and I kind of became pals her freshman year in high school, and it was so rewarding to develop that close and supportive relationship. And it was kind of overwhelming, to tell you the truth, because she became so trusting. It kind of blew our minds. And I remember one day she said, "Mom and Dad, I've got to talk to you about something here." She said, "My boyfriend Dave wants to sleep with me. And should I do that? And if so, should I do it at his house or our house?"
Like your bed or mine?
We weren't looking for that much trust, sweetheart. It's kind of scary, but it was really a beautiful, beautiful thing as well. And there's it's so easy for us to lose the trust of our kids.
Yes. And I also think, David, we didn't model this, but I oftentimes will, if I feel conflicted, as I think this mom, sorry, I just adjusted my microphone, as I think this mom did, like between wanting to feel close and loving, but also not wanting to lose control, right? I think she's really afraid that if she were too loosey-goosey, that he would be getting into trouble, or maybe even hurt. Like if the rule was about not driving friends around in your car because she's worried that he'll get into a car accident, then I just would be more open about that. And maybe she did prior, but I would say, I would say, gosh, it sounds like you're feeling really pissed off with me right now, really annoyed. You just want to kind of get out of here and go to your dad's. And, I totally get that. I think I've been maybe, overly controlling or not understanding. I haven't done a good job of listening to you. I want to do a better job of that. I want to know more about how you're thinking and feeling. And I also want to share with you that I feel kind of stuck sometimes. Like I want to be really close to you. I want to give you your independence. And I also love you so much, and I don't want anything bad to happen to you, right? I get worried sometimes when you're driving your friends in the car. Like the reason for these rules comes from this place where I feel, worried.
Yeah, and I need your help with this, to tell him.
Right.
I need support from you too. It's such, wow, it's beautiful the way that you're putting
just to be open and sort of vulnerable in that way, right? Sharing that this is hard. I don't always make the best choices. I sometimes make strict rules, and where I'm coming from is this place of loving you and wanting to protect you.
Yeah, maybe we can work this out as a team.
Yeah,
it's so neat. Lisa is filled with great comments all the time, and again, happy healing to you. Lisa broke her hand and foot bringing her daughter over to Scotland. Her daughter is going to veterinary school, which is totally awesome. But we send you warmth and loving vibrations for for healing. It's tough to have a broken hand and foot. But anyway, Lisa says, and yet all this is so hard in the heat of the moment. That's absolutely true. So you may be needing to do your own daily mood log too. Look at your negative thoughts and what you're telling yourself, and talk back to them from an individual support point of view. And also, you have to have high desire to do what we're suggesting. And in addition, if you want to do it, you're going to have to practice a lot. Now, when you hear Jill, you hear kind of like a communication genius. And I think you are a genius, really, at this type of thing. And you may have always had this incredibly high aptitude, but also, have you seen in your own life, Jill, that you've had to practice to acquire these skills?
Absolutely. No, you're very kind. And yes, I would say it has always been my preference to talk rather than fight. I mean, I do think that was sort of my temperament as a kid. I think I've told you this funny story, David, but when my parents and I used to get in arguments and I was super mad, I would write a long letter to them because I really wanted them to know everything that I was upset about. And I didn't love screaming and yelling. So I'd write this very long detailed note and I would tape it on the outside of my bedroom door, and I would shut my bedroom door and I would wait till they read my thesis and then I would have a conversation with them. But so yes, it's my temperament, but honestly, I moved to California 11 years ago. I met David. I read this book, Feeling Good Together. I kept it by my nightstand. I reread it like over and over again. And I thought, I can't even believe how much I have learned and how much my communication has changed with everyone in my life just from reading this book and practicing the 5 secrets. Like, I definitely think it's a game changer.
That's very kind of you to say thank you, but it's absolutely true, and you have to really want it. I start out from a terrible place, and I had very bad interpersonal skills. I was always a great therapeutic technician, but I didn't have that tender piece, and I just had to work really hard to learn how to communicate, really, and to learn how to show an interest in other people and to hear what they had to say rather than arguing and defending myself. But if you want to do it, you can get it. But you have to know that it's going to be challenge.
It's a lot of work. It takes practice. David, I also shared with you when I was first reading the 5 secrets, I was actually really excited about it. I thought, well, I have this toolbox that I can learn and apply. And so I would be driving around in my car and I would be practicing, alone in my car, and someone would, swerve into my lane and I would practice saying like, wow, you must be in a real rush today, Like, I'm guessing that you're feeling really kind of impatient and gosh, I'm feeling kind of frightened though, because, so basically I'm half teasing, but practicing using the 5 secrets and responding empathically, like throughout my day, at the grocery store, at the gas station, while alone in the car.
Yeah, and we're going to drill down on this in our Tuesday group at Stanford. We're going to do for the next 2 months, we're going to give them basic 5 secrets training because it's hard to learn. It takes time. A couple things where Jill kindly, or Lisa kindly pointed out that you, Jill, and I are going to give a 1-day workshop from 8:30 a.m. to 4:30 p.m. on October 28th in Mountain View, California. And you can also join online. And we're going to show therapists step by step how to do interpersonal therapy with your patients. When you have a patient with a troubled relationship, how you empathize, how you do agenda setting, and how you use the relationship journal and the 5 secrets of effective communication, how you could effectively teach these things. And if you'd like to join us, you can go to my website. In fact, Lisa has a note on, if you have the list of people, it's up toward the top. But my website is www.feelinggood.com, and go to the workshop tab, and there you'll find this workshop described and link to go and get more details and to register. You can also find it at www.feelinggoodinstitute, one word, Feeling Good Institute, 2 G's in the middle, feelinggoodinstitute.com, and that's on Sunday, October 28th in Mountain View, California.
And live streamed, right?
Right. Now we're going to have Q&A for everybody, but we use the whole time on this one thing. But David's got a question here. Is it recommended to give the Easy Diagnostic System or survey in the initial session to every patient that seeks therapy, even if it's just related to a relationship issue? Well, Jill can probably give you a better answer to that, but I would say that, if someone's just coming in for a relationship issue, you might not need to do the Easy Diagnostic Survey. On the other hand, patients can take it on their own, so you don't waste therapy time and just glance through it, because you might find things that you didn't know about the patient, like they might have a drug addiction problem or a personality disorder.
My answer, being in no way connected to the writing or execution or finances of the Easy Diagnostic, is to say definitely I would do it with every patient. The fact of the matter is it doesn't take up any therapy time, right? So I usually hand it to my patient in the first session, ask them to complete it before the second, because I usually do a 2-session evaluation. And it gives so much information. And if you think about it, it just saves time in session. You don't have to ask them all those questions. And if you have a patient that's coming in just for a relationship problem, I still want to know, do they have depression? Do they have OCD? Even just, do they have dependent characteristics? Have they ever had a manic episode? So I would have to, in my opinion, I think good evaluation assessment is key to any kind of therapy. So I would feel the need to ask all of those questions if I didn't administer paper and pencil diagnostic. So I say, it costs no therapy time, just your patient fills it out, and then you can take time in the session going over it with them, or you can look at it on your own and only bring up questions.
Yeah, and then many kind comments, a lot of compliments for you, Jill. You're really skilled, Jill, says Lisa, and so right. Dipti says, Jill, that was so cute, and so forth. Gregory is enjoying the podcast and also enjoyed the workshop in Pasadena. And thanks, Greg, for coming. I really enjoyed getting to meet you. Greg is a police officer and a therapist, and it was just kind of awesome getting to know you. But there's a question here, a beautiful one from Jay-Z, and maybe we can both answer this. Hi, David and Jill. As a fellow cat lover, I just wanted some advice from you. My beloved 10-year-old cat had to be unexpectedly put down on Monday, and I'm so sad to hear that, Jay. He is survived by his brother, who seems lost without him. They must have had a loving relationship. When our cats have died, the other cats have rejoiced because it meant more time getting our attention. And if one of them was sad and grieving, that showed you had two cats really loved each other like your two cats.
They were brothers, it says. Yeah, I have brother cats who are so attached to each other, so I can only imagine.
Jay says, I'm having feelings of not wanting to have any more cats after the last one we have now passes away because it hurts so badly when they die. How do you decide to keep getting more cats or not? Well, that's such a personal thing. And the fact that you hurt so much is just a beautiful thing about you. And I guess for me, it might sound strange, but part of the beauty of it is the sadness that I feel when I lose a cat. I lost my Obi, who I loved more than anything. I lost my Popcorn before that, who I loved more than anything. I just love them more than life itself, but I'm grateful to grieve and to love them and to feel the loss. Every time I jog, it's been almost 2 years now since we lost Obi. We see people post photos. They see the mountain lion in the early morning around our house, and I'm pretty was lost. But I still shout his name every time I jog at a certain area. I shout Obi like that. And I know he's not going to pop out from behind a bush, but I just do that as a kind of ritual. And I just loved him, and I'll always love him. And we have two cats now. One is elderly and won't survive much longer. He may have some imminent problems. We're beginning to sense. He couldn't walk a few days ago, and he's walking now. I don't know if he had a little stroke or what happened, but he kept falling over. It was sad, and we don't even know how old he was. He was multiply abandoned when we adopted him as a gift to a neighbor. Didn't want him anymore, and he was elderly when we got him, but I don't know, maybe Jill can tell you.
Well, what I would say is my heart goes out to you, Jay-Z. That sounds really sad, and David can obviously relate. I have 2 young, healthy ones right now, so I haven't lost a cat actually, but I think what David said is that it's so individual. What I would offer to you would be, I mean, my guess is it would probably be wise to take some time and to see how you feel, because I think we all know that feelings that can be very intense in one moment can feel very different, a couple of weeks. And it may be really good and helpful for you to grieve, right? Grieving is this period of time where you can kind of affirm how much you love this cat and how much he meant to you, and maybe you need that time. And then I would reevaluate. And then sort of from a therapy perspective, if it were a patient of mine who were saying, I can't decide, Dr. Levitt, I can't decide, do I want to get a new cat or do I not want to get a new cat? I wouldn't tell them, well, Jay-Z, here's what you should do. You should either get a new cat or don't, because I wouldn't know what's best for you. But we have a great tool that's called the decision-making form. That's kind of a cost-benefit analysis, a 2x2 cost-benefit analysis. So certainly, like, once you've given yourself time to love and mourn and grieve, you might feel ready to think logically through the decision and think, what are the advantages and disadvantages of taking a new cat on or new ones on versus, kind of making peace without having more cats. So I'm sure that with some time and some thought, you'll be able to make a decision that feels really good to you.
One last question, because we're over time. But Roger says, I have a client who just hates to fill out the testing before and after a session. How would you handle that? And this is a quick answer. I would ask the patient to tell me what it is he doesn't like and why he's upset about it. And I would empathize, but I would also say that I can't treat patients without the information. And that if he feels strongly that he doesn't want to do the testing, that there are many therapists in the community that, like himself, don't believe in the value of the testing, but that the type of therapy I do, really, I need to know how he feels about each session, whether I'm helpful to him, what he likes, what he doesn't like, and so forth.
Right. He might not like it, but would he be willing to do it in order to work with me? In other words, that we describe it as a requirement of doing the work together. So you could use really good 5 secrets and really empathize and really understand what it is that's so hard for him about it. But ultimately, the way we practice is that it's a requirement. It's just a part of the process of therapy. So if he didn't want to do it, I would have to say I would be disappointed to lose you as a patient, but I would respect if you didn't want to work with me because I require these forms, and I'd try hard to find you, a wonderful therapist that you could work with. I hope that you'd choose to work with me and be willing to do the forms.
Oh, by the way, just here's how you can show someone's note.
Okay, very cool. David just learned something new.
Yeah. So anyway, thank you all for joining us today. I mean, it's always so great to work with you, Jill, and with all of you folks too. I would give us the show a 10 out of 10 in terms of my enjoyment. I just love working with you. We do
have a lot of fun together.
Yeah.
Yeah, the questions and comments are really engaging.
Okay, I've got to end the broadcast. Have a good day, everybody, and hope to see you soon. Our next one will be in a month. Will it be the first or second Sunday, Jill?
Yeah, we have to figure that out.
We'll figure that out.
Yeah, we'll post. Okay. Bye, everyone.
Bye-bye.